Welcome to the short series. On this particular case, we're looking at a patient, a male age 67 with a history of progressive dysphagia and loss of weight that was referred to radiology for a barium swallow examination. About 80 mils of barium sulfate. The patient underwent a fluoroscopic exam. On the AP view and the lateral view, we can see that there is irregular narrowing of the proximal portion of the esophagus. We can see that there is destruction of the mucosa and shoulder margins are evident, as well as a rat tail appearance. When we see these features, it does confirm, radiologically speaking, that we are dealing with a case of clear esophagus. In terms of the incidence of clear esophagus, we find that this is quite more common in blacks than other races, and there's a male predominance in terms of its incidence. So given that incidence now, in order to confirm the diagnosis, histology is the gold standard, and the distribution in terms of the histological subtypes, we have two, which is the squamous cell carcinoma with an incidence of about 81 to 95%, and the adenocarcinoma of the esophagus, which is about 4 to 19% worldwide. In terms of imaging, other than doing fluoroscopy, endoscopic ultrasound can be performed, as well as CT and FDG PET, which is quite useful in detecting esophageal primary tumors. In terms of prognosis, we look at, for those with localized disease, there's a 40% chance of 5-year survival, and those with distant metastasis, it's about 5% 5-year survival.